Hello everyone, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Buoy Health. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion, and we will get to them at the end. Stay tuned immediately following the discussion to watch as Mike Super teaches us a few magic tricks. If you've got a deck of cards lying around, you'll want to grab it. And with that, I'll throw it over to our moderator who joins us from Business Insider, Lydia Ramsey.
Welcome everyone. My name is Lydia and I'm a healthcare correspondent for Business Insider. I'm on week 10 of working from home and I'm based in Brooklyn. That being said, I hope to one day resume going to an office in Manhattan, but in the absence of widespread treatments and vaccines, I'm not holding my breath for that to happen anytime soon. The realities of the novel coronavirus and how it spreads, especially the fact that there are asymptomatic infections, poses almost impossible questions for employers about how they might go about reopening offices. That will be the topic for today's discussion, the resilient workplace. Joining me, I'd like to welcome Dr. Andrew Lay. He's the CEO of Buoy Health, Dr. Lorna Friedman, the Global Health Leader, Multinational Client Group at Mercer, and Bryony Nguyen, the Senior Vice President and Chief Strategy and Innovation Officer at Blue Cross Blue Shield of North Carolina. Thanks to you all for being here. Like they said earlier, please feel free to submit questions via the Q&A feature in Zoom. I'll be sure to get to them toward the end of the conversation. And yeah, with that, I'd love to kick it off with a little bit of an icebreaker. I'd love to hear where everyone, two specific things, where everyone is based, just to make sure everyone's not in an office really at this point. So I'd love to hear where you are. And the second piece, when you expect to be back in an office. Bryony, how about we start with you?
Yeah, absolutely. Hi, Lydia, and hello, everybody. Thanks for having me. I am currently in Chapel Hill, North Carolina, not where I'm originally from, as you can hear. I'm actually Zimbabwean, and haven't been in an office the same as Lydia for about 8 weeks, and don't expect to until earliest midway June and maybe beyond.
Great. Andrew, how about you?
Hi, everyone. So we're based here in Boston. I'm also here in Boston, the South End, where our headquarters are. And in terms of kind of when we're going, thinking of going back, we're really waiting for two kind of core pieces to be in place, understanding what an antibody test means, which I think we're going to talk about quite a bit today, and then, or when a vaccine is out in market.
Great. That's a good open-ended win. And Lorna, I know you're here with me in Brooklyn. What about you? When do you expect to be back in an office?
Yeah, so I'm here in Brooklyn, and I think this is sort of the topic of the conversation, right? So it's not exactly when, but really what needs to be in place for any of us to have that comfort level. And given that I'm global, and though we have offices here in Manhattan, I spend a lot of time on a plane. So I think that's even a more extended conversation in regards to when I will be back in my regular office.
Right. Travel is itself a different kind of office and a different threshold for sure. And with that in particular, the biggest question I think everyone has at this point to what you guys mentioned is the how of this. How in the heck do we get back to work? Andrew, how does Buoy kind of fit into that puzzle? I was hearing a little bit about some of the work you guys were doing. Is that something you guys are actively working on?
Yeah, Lydia, and we really started thinking about this problem because we, responded to COVID, really early on. I think we released our COVID tool back on February 7th, and then became the front end for the state of Massachusetts. Different payers like United Healthcare, Cigna, Humana have released us as kind of a COVID front end. And then the state of Massachusetts really has brought us into the world of contact tracing and how we could help out there. And it really just started making us think about, all right, so what's going to happen next? A vaccine, let's say, is 12, 18 months out. Dr. Friedman and Bryony, I'd love your perspective on that, but that's like our understanding is, best case scenario, 12 to 18 months out. Let's work in another 6 months for distribution. We're going to be in a COVID positive world for some time. And, the options that we have are, there's no silver bullet. So we started turning our attention to how do we think about helping people kind of return to work, given that we had responded already to COVID. And as we think about it at just a really high level, because there's no silver bullet, every solution that we have out there on its own has some level of weakness. We feel like the best strategy is to layer multiple kind of solutions on top of each other. I think that's one really core component. A second piece is really understanding each individual employee's risk factors as it pertains to how hard it is for them to come back to work. So Lydia, you kind of referred to this before. One of the big issues is that asymptomatic individuals can be carriers. And so that makes the decision of who to go, how to bring people back to work really hard. So I think the idea of just using like a symptomatic questionnaire, are you symptomatic? Yes, no. If no, come back to work. That brings a lot of risk involved. And so the way we're thinking about, in addition to layering, is actually thinking about at the individual employee level, who is living at home with that employee? Are they living with someone who's immunocompromised, right? Two, what underlying medical conditions does that employee have? And then three, what kind of risk do they pose to their fellow coworkers by coming into work? Great example here, Dr. Friedman, Lydia, you guys are in Brooklyn. We have a small office in Manhattan. If all of all my teammates in Manhattan are taking the subway in, that's a different level of risk per person relative to a setting where everyone is driving in. So understanding those different risk factors, as well as understanding that there are different solutions, how we're thinking about it is marrying both multiple solutions, but understanding each individual's risk and having a comprehensive solution that takes those things into account for any individual employer to say, all right, here's my strategy to bring in a fixed amount of risk per day, knowing that, we're in a really good spot where everyone can work from home. That's just not the case for a lot of different employers. And so we have to think very thoughtfully about how we can help other types of companies come back in a measured way. So maybe I'll stop talking. Sorry, I'll get off my soapbox.
No, that's a great point.
That's how we're thinking about it.
Yeah, absolutely. It's one thing I've learned through kind of reporting on this and living through this is it sounds like there's not going to be a single day when everyone in every office is back on the subway and back to work. Lorna, you work with a number of employers. Like what kind of questions are they asking you? What are they looking to you for in terms of that, how they're thinking about getting back to work?
Well, I think sort of to echo some of the pieces that Andrew commented on, one is just a reminder that millions of people don't have the choice. They are at work, they are essential workers, so they're not returning. So fundamentally, there are some lessons to be learned there in regards to how to keep people safe. And, there are some challenges. And clearly, just pointing to the subway, over 100 MTA workers have died in New York. So the risks that people take is on a personal basis, and the obligation and our duty of care to keep them safe is quite significant and quite real. So there are criteria, and in regards to looking at the severity of the pandemic and whether or not, right, these are federal guidelines, whether or not you have a decreasing and whether or not, importantly, there's testing available, which I know that both Bryony and Andrew can comment on. And then I think one very particular one, and again, if we look at New York, or if we look at Northern Italy, the other factor is whether or not there's capacity in the healthcare system. So, when Northern Italy was at its worst, the capacity is 150%. Here in New York, we turned our conference center or convention center into an ICU. And though in the US, we have ample amount of ICUs, we have almost 10 times that they have in China, the distribution is very uneven. And when you look, almost half the counties in America don't have an ICU, let alone a certified physician to operate within those. And those are often counties where their people are, in fact, the most vulnerable. They have the most vulnerable populations, either disproportionately those risk factors, clinical risk factors like hypertension or disability or diabetes, or they're older. So even though there's smaller numbers in little communities like Sioux City, Iowa has 31 ICU beds per 100,000. The Bronx has 51. So I think really when employers think about that, it's kind of complicated. They really need the help to kind of identify lots of grids about whether or not there's the intensity. And the last thing before I turn it, and I'm just curious to hear, Bryony's really in a state that I think emphasizes this, is that people are going to come back and they're going to, have to go out again in some cases, right? We don't anticipate that this is a linear relationship. It is going to be sawtooth.
Absolutely. Yeah, that's a great point. Bryony, I would love to understand a little bit more about the health plan kind of piece of this. It sounds like testing is going to be a big piece. How are you grappling with that? How do you get employers back to the office?
No, it's a great question. And Lydia, I love the way you've just put it now, which is back to the office versus back to work. Because I think we have to be, also acknowledge so many people who are currently working. They're not doing it in a usual or an office setting. And the health plan thinks about it really from, multiple angles, but the two primary ones are, as a player in the healthcare ecosystem, how do we support our customers who are employers, but also the providers who we know are on the front lines of delivering this care? Unlike many industries, the widgets or the supply chain for a payer are actual real people who are grappling with their own physical safety risks of being at work, as well as, their children who aren't. And, this is it's a very complex time for the healthcare industry. And then secondarily, but equally importantly, we're a member of an economic community and a business. And if you think about Blue Cross North Carolina, we're a big employer in the state. And we support a number of the big employers in the state. And so from a macro perspective, balancing all of those, and I do think it's a balance, not a trade-off. I think we shouldn't define this in terms of life or livelihood, because I think that's actually a very unhelpful debate. But what are the thoughtful and innovative ways that we can create this new normal that might actually build on some of the very exciting things that people have wanted to do for a long time? How do you create workspaces that are more tailored to individual families and situations than they are everybody at this job level or everybody in this industry does X? I think this gives us some opportunity to be creative around this.
Great. Yeah, that's a good point. It's interesting. I think a lot of people are realizing a lot more of work can be done from home than they expected. I've been talking to some employers in the healthcare space, and even a large hospital here in New York told me that they think maybe a third of their workforce might be working remote, maybe not all of the week, but some of the week. So it's really interesting to think about how that's changing. As we think about this, and it sounds like there's no one size fits all, there's nothing specific, but I'm hoping we can kind of iron out a few of the key outlines that'll be the case for every single, employer, every single entity looking to get back to work. I know, Lorna, you mentioned, there's a lot of federal things that'll have to be in place, like case counts will have to be lower, things like that. I think one of the elements we've talked a bit about today too is antibody testing. I'd love to get everyone's perspectives. Like, are there like 3 or 4 different elements that'll be key to everybody's plan to get back into the office? Andrew, maybe we can start with you.
Sure. I think kind of building off of what I kind of started with, we see like 3 core problems that kind of fit to like a strategy. So the first is that, again, there's no silver bullet. So whether it be antibody testing, PCR testing, PPE, social distancing, each one has its own weakness. So we really feel that you have to layer multiple strategies on top of each other to really have a good effect. And the comparison I make is to, if you think about HIV, people don't die of AIDS very, that's rare now to really see that. I would say that that is a victory for modern medicine. And the way that we won is that we have a cocktail of medications that attack the virus in different ways. And in a similar way, when we think about the strategies that employer entails, because there's no silver bullet, if you work in social distancing, in addition to PPE, in addition to shift management, in addition to thinking about people's risk factors, I think that is like where you can see a lot of really good effect. The second problem, going back again to what I said originally, was that you have to take into account each individual employee's risk factors, but in a way that like really keeps employee trust and privacy at the core. You know, there was an article out in the New York Times a couple of days ago on, you know, fear that what we're going to do from us to you know, improve safety might really lead to outcomes from a privacy perspective that we didn't intend to get to. And I think that's something like really important to think about. So how do we gather information about people's preferences, people's childcare situations, people's risk factors at home, how they commute, all that good stuff, make it actionable for the employer while guarding the privacy of the employee? I think that is the kind of second big piece. The third one I did not mention is that we have to do all of this while thinking about limitations on the supply side of healthcare and the economics of it all. Because we've been hearing from a lot of employers saying, all right, well, if I tested everyone in my population before they came in, that test by itself would be extremely expensive. And then the second they finish their swab or whatever, they could walk outside and get infected before the result ever came back. So theoretically, you could, and the employer said, I feel like I could go broke just testing. So that last piece, because you have limited resources, you have a limited number of supplies. If you had 100 tests, who would you use the test on? I think the piece that we're not talking about is if you install the strategy of bringing people back, how do you know it's working? Because if you don't know it's working, how do you know the ROI and the benefit of all your different strategies that I just kind of talked to you about before, right? You have to have some sort of feedback loop, because in any business, you would kind of know, okay, well, if I spent this and I got this, that makes a ton of sense. In a similar way, I think the third piece of of like how to do this well across all employers is, if I install this strategy, how do I know that it's working? And then if I know that it's not working, that means I can change my strategy again and kind of iterate to really get there. And that last piece on the strategy and the feedback loop, I think what's fascinating, I think we started touching on the government piece, is that most of what we know about coronavirus, we're learning from whole other countries, right? Whether that be Taiwan did this, South Korea did this, and they did a true top-down kind of model for returning. In the United States, putting politics aside, there has been a lot more kind of dispersion of kind of decision-making at the federal level, then at the state level, and really even at going down to the employer level. There's not a lot of kind of guidance. And even as guidance comes out, there's going to be a lot of gray area for interpretation. And unfortunately, one of the issues is that it's not like there's a strategy at the employer level that we could look at another country, because again, most other countries did it from like a pure federal level down. And so having that third piece, that feedback loop, means that you as an employer can actually learn your way to a strategy that works for you, which is really important given that there's not a lot of precedent for, what we're going through right now. So I think those would be the three things.
Yeah, absolutely. I mean, that supply piece especially has plagued the U.S. response pretty much from the beginning. I think most of the stories I've written have had some kind of curve between, okay, we don't have enough, now we do, now it's another thing that we don't have enough of. So I can imagine employers are grappling with that as well. And one of the things I keep hearing from our conversation so far is I feel like there's this changing relationship that's kind of at play here between employers and our health. It sounds like if we are to go back to work, maybe there'll be temperature checks involved. Maybe we will have to know who is at more risk, and that might be information I would have never shared with my employer before. Lorna, I'm kind of curious from where you sit, like what kind of issues could that present? What kind of pitfalls could we experience as we kind of navigate those questions?
So I'm a physician, and it's really dangerous when I start to pretend I'm a lawyer. But I think you bring up a really good point, right? And Andrew, this is not our first pandemic, and you highlighted HIV. And if the history of epidemics in humanity has taught us anything, it is that there is a proclivity towards bias. And we have laws about that. And there's a reason why we are not asked to share this information. And so we do highly recommend, to get back to your question that you brought up with Andrew, is that you do need to think of things, like the EEOC, and certainly HIPAA, but other issues around labor discrimination. And again, the unintended consequence of doing something that you think is good, or even an individual, of course, the unintended consequence can be quite negative. So legal counsel is absolutely part of this discussion, and really, again, reiterating where there has been some relaxation, but not, and whether or not you as an employer actually want to embrace that relaxation. Maybe, and again, that may be a term that's even too loosely used. But so absolutely looking at the existing protection we have for individuals is paramount. The other piece I want to, and I think both of you have brought this up, in regards to the return is, and whether or not we use that word, whether or not people is individual lives. And there are 54 million children out of school. So there will not be a comparative ability to come back into any kind of workplace if you're not required, while we're still in a situation where children out. So again, that's part of the variable, which I think employers have to look at when they're looking at a pandemic response, or whether or not, an environment is really safe, or whether or not it's actually feasible. So there's safety first, and then there's feasibility. And certainly childcare is a major feasibility issue.
Absolutely. And that's something I want to get a little bit more into. I think about what we're going through in kind of three stages. We have our pre-pandemic stage, and then we have our pandemic stage, which is what I consider us to be in right now. And then we've got a post-pandemic world. That'd be something where there's a widespread vaccine available, or something that keeps this at bay and we've figured it out. And while we're in this kind of center bucket, I think a lot about how are employers able to support and create a resilient workplace when that workplace is at home, when people are caring for kids, or like doing school lessons, or helping out with elderly parents and things like that. Bryony, what have you kind of seen and observed from the health plan perspective here?
Yeah, so Lydia, I think information, and then like Andrew was saying, a plethora of strategies layered on top of each other. So one of the first things I think that companies can and should do is just provide very clear and accurate information to their employees about what's going on in the state or in their environment, what they're considering, and as far ahead of time as possible. So for example, I think it is helpful to say the state of North Carolina has 7 metrics that as a state they're using to move from A to B. And clearly the first thing we're going to do is follow state guidance. And this is what they are, in a way that people understand. Even for people in the healthcare industry, things like contact tracing, these are, somewhat complex concepts. So just let's put out, what are these things? What does it actually mean? Percentage positive as a percentage of total tests. Well, this changes dramatically depending on how many tests you're delivering, right? Because it's going to be very high when you have restricted tests. You're only going to do it to people who are highly symptomatic. And explaining to employees that piece. I think the second piece is just being very clear on what are the steps companies are taking to address this. I've heard from employees examples like, can you just tell us if we're going to cancel all big events in the third quarter or not? And I think you will have seen so many companies come out, Salesforce has, Google has, many companies, and said, look, we're canceling big conferences for the rest of the year. There are downsides to that, but I think the real upside is massive, creating some sense of certainty in a very uncertain time. And I think that type of thing is important as well. And we're seeing more and more of the non-health related responses, but just certainty related responses. And then I do think there is a big piece around, and Lorna sort of raised this, I'm a mom of 3 kids under 5. So my eldest is 5 and my youngest is 4 months. And this is a, it's a difficult time when you have people working from home and your kids at school, etc. I have colleagues who are loving it, who are saying, this is the most productive I've been in years. I feel I can get a workout in and, miss my commute and be more on the ball. And I think we should celebrate both of those things and understand both of those things. We have an incredible chief people officer who always talks about crises are not the time to build your culture. Crises are the time to draw on the culture that you've already built and be true to it. And I think that is an incredibly important thing to wrap around this box of individual initiatives. But what works for you and your people and your company? And it's not going to be one size fits all.
Yeah, absolutely. Yeah, and I think, well, among those elements, to your point about childcare, we were talking about this on the call, and I'd love to get into it a little bit more. There sounds like there's this element of additional benefits or additional kind of support tools that might need to be added to, a company's plan or things like that. I guess, Lorna, how have you been seeing this happen? How are you speaking with employees? Employers, what are they asking you for in terms of benefit design? Are there changes that we need to find where people are able to use more telehealth or able to use more mental health services, things like that in this kind of interim period?
Yes, so certainly I think it's clear that, again, one of the, I don't know that I would call it positive outcomes, but one of the definite outcomes from this virus has been telemedicine. So, and if we look at whether it's just the numbers of use, the numbers of providers who are coming on, and then additionally, when we look at our own data, we know that employees were really open to it. So clearly telemedicine and the ability to which the efficiency inherent in it is a real positive.
Yeah, that's really interesting. So I guess, Andrew, what have you noticed in the way you've seen buoy used in this particular pandemic situation? I'm sure what you're seeing today is probably different than it was back in March and might be different in a couple months, but yeah, we'd love to walk through that.
Absolutely. It has gone through its own stages. So because we responded so early on, again, we were out when there were like 4 confirmed cases in the US, and we have a large user base on our platform, kind of pre-COVID times. We started seeing pockets of high risk for coronavirus based on CDC guidelines right before a confirmed case would pop up in that area. So it's pretty interesting. We started in Washington State. We saw a 96% increase in COVID symptoms in this month of February relative to the previous 2 months, when the rest of the country was only seeing a 28% increase. And we looked into it because we had heard that the case in Washington State, the person had actually been walking around for 4 weeks without a test. And so they were likely spreading the disease. And the first time we saw it, we're like, oh, this is probably an anomaly. We then started seeing it again and again. All in, we saw across 17 different states, we would identify the area of high risk right before a confirmed case would pop up. That hotspotting data became, it was really interesting early on. But then as we started rolling out these commercial deployments of buoy for coronavirus, and really the problem we're trying to solve is that, going back to Dr. Friedman, your point about there's a real load balancing issue, right? There's like only so many hospitals, there's only so many ICU beds, and from a telemedicine perspective, there's only so many doctors that can sit on a telemedicine platform as well. And we were seeing really massive wait times, 3-hour wait times, 300 people waiting in line to talk to a physician. We saw there's a really big value of having something ahead of that, essentially move people into telemedicine or in-person care when necessary, or move people into self-isolation when they should be in self-isolation. So our commercial product, when we rolled it out to these large payers and these large state governments, we were seeing, for instance, in Massachusetts, in 5 weeks, we saw over 100,000 people use the product, and we saved, and what we found was that over 50% of the time, they didn't need to call a doctor. And over 90% of the time, they didn't need to go to the doctor in person. And so we ended up saving 71 days worth of physician's time in 5 weeks, all of which preserves the supply for people who do need to call and who, people who do need to, go to the physician. But then now that's even morphed now as we moved to return to work and focused our product and our company there, where, we're really thinking about going back to this as being a great time for telemedicine, back to Dr. Freeman, your point. What we're building for return to work is that people are coming in on a daily, weekly basis. They're checking their symptoms if they have any. They're talking about their exposure, and we're moving them into self-isolation if that's appropriate, checking in on them, navigating them into care if they're symptomatic. And then if they actually are asymptomatic and not exposed, which is going to be like, the majority of the time, we take into account their risk factors to help the employer establish a strategy that we trust. So the employee wouldn't know that I, Andrew, have a loved one at home that has asthma. The employer would have created some strategy to say, I only want this percentage of people in that risk category to come in that day. So you keep the amount of risk relatively flat on a day-to-day basis without needing them, without the, doing things that are discriminatory to the employee. But what's interesting about that whole ecosystem is that why Buoy got started to begin with is that we're trying to break the habit of people Googling their symptoms, which 72% of Americans start their healthcare journey in pre-COVID times by searching for their symptoms online, reading something crazy, and then doing the wrong thing. And now, if people are remembering to check Buoy before they go to work or if they're symptomatic, we see this as an amazing opportunity to build a direct relationship with the end user and basically, help them understand the next time you're sick, you're thinking about COVID today. But this doesn't mean that you're not going to have knee pain next week, or you're not going to have, your kid's not going to have an earache tomorrow. And we're kind of retraining people to remember that, your employer's probably created a service that's much better than kind of searching for your symptoms in a, non-personal, scary way. So we see that as a really big opportunity for the changing in the usage of programs like telemedicine, like us, kind of in the COVID world and in the post-COVID world.
Yeah, that'll be really interesting to see. I think a lot of people are learning new behaviors. I'm getting very good at using Zoom, things like that. And I'll be curious to see how much that sticks around by the time we're out of it. And to your point, Andrew, I think there's a lot of, it sounds like there's a lot of, now I wouldn't want to call it positivity, but there's a lot of white space, it seems, for solutions and for things to help people navigate, where to get a test, how to do something like temperature checks, things like that. Bryony, from where you sit, what would you like to see, or like, what do you wish you were able to kind of add to a Blue Cross Blue Shield of North Carolina kind of plan at this point?
I think there is a whole set of things on the medical side. Things like telehealth infrastructure. We've actually found that our hospital system partners have really taken to this as much as the customers. And that they have found it very efficient, for example, not asking folks who are at risk for all sorts of other things, not only COVID, to come into care settings, but actually can deliver care at home. This is great for rural care. And also really good in terms of behavioral health, telehealth, and mental health, counseling, that type of thing. So having employers think holistically around that, I think is something that we've seen more do, and certainly Blue Cross of North Carolina is as an employer, but we can see more of. The secondary thing I would say as well is we need to continue as an industry to see people as whole people and not as a collection of medical symptoms. And as an industry, we've talked a lot about moving to integrated care in terms of mental health and physical health, but there's an entire realm of a person beyond that. And, there's a lot of reporting at the moment that 1 in 4, so 25% of American children are at risk for food insecurity during this crisis. I mean, it's appalling. And at least with the current stock of food, it's also unnecessary. So this is a supply chain issue. I think we need to, and I would encourage employers to continue to think about the beyond work and medical care alone implications of this crisis into things like food insecurity. What are we looking at in terms of shelter, how are we thinking, we've talked about the childcare issue, across their entire employee population, and then disproportionately, I think, across their female employees. I think this crisis is going to elevate fractures we've already seen in our society, and make them even more transparent.
Yeah, absolutely. It's going to be really tough to navigate that, especially if we start getting these conversations where we're headed back to work, but not everything is in place. And, I think we have a few, get your Q&A questions in, because I'll be turning to those in just a second. But I really wanted to get a sense from you three are such experts in the area. I think one of the other big questions, and we touched on it a bit here, is how will we know when it's time to go back to work? I think there's a lot of metrics out there and a lot of guideposts. I'm really curious what you three look to as the most important thing. Andrew, as an employer yourself, and you've got your company underneath you, what are you looking at? What's the stat? Is there like a perfect stat you're able to keep in mind when thinking about, oh, it's time to reopen Boston, or oh, it's time to reopen New York, things like that?
I think, thinking about your question a little bit, definitely the baseline kind of prevalence or incidence of coronavirus in your community has a lot to do with whether, it's time to think about how we reopen. I would say that one of the real issues is that drawing a line in the sand at some number is also, really difficult to say that, this very particular level is the time in which we can consider going back. When it comes to just thinking about Bowie as an employer, I think the stuff that we're considering and bringing people back is, I think first just thinking about the different roles within Bowie. So we just happen to be an employer that can work remotely without with no issues. And so that just changes the risk calculus for us, right? Because the benefit of us all being in person versus the risk just kind of weighs very much in one direction, because the alternative is that, we can work from home. And so that's really leading us to be more conservative in kind of how we think about kind of bringing people back. For employers that, don't have that in place, or, there's a mixture of essential and non-essential, I think it becomes, really, interesting and difficult really to get that nuance down to the role level, down to the office level, as to how to bring people back. So similar to the fact there's no silver bullet for, solutions, I think one interesting thing is that the singular metric is also hard to pin down to say, like, if, this number, then like we're going back. But I do think that kind of related to the whole point, like, one community has this level of incidence of coronavirus in the community. If we do think about the incidence of coronavirus in a single population within an employer, thinking about that as the outcome, I think is really interesting, because then you could, again, going back to this idea that if you know the output, you could measure the input, and now you have input output, and you could change the way that you're kind of strategizing to say, all right, here's what's going on. So I would really encourage employers to think about, how am I sampling my population to understand the incidence of coronavirus in my group, so that I can continue to titrate my strategy to understand, what to do next.
Sure, for sure. Lorna, how about you? Are you using prevalence as one of the metrics?
Absolutely. And I think, again, to the point of using it on a community basis, if you're large enough, depending on your operation and the risks in your operation, you have an obligation to do some, kind of surveillance. And I want to get back to this concept of return, because it really is a phased approach. It is really more than likely a very long haul, and more than likely, many people will not return. And three reasons. One is the economics that we're currently confronting, and I think Bryony kind of conferred this, and certainly this audience is already aware of the intense impact social determinants have on health, and you may have entered this pandemic without certain risk factors, but you will be leaving this pandemic with other risk factors. And so it's really behooves employers to contemplate that both on a site basis and a community basis. So that's one piece. The second is people are not coming back, because if we look at 2001 and we look at 2008, they didn't come back either. So you look, even though in 2015, the unemployment rate was low, actually the people who are participating in 2015 in the employment, in the world of employment, was like 62% comparative to back in 2001 or 2002, it was much higher at 67%. And to Bryony's point, women disproportionately represent that group that's not coming back. So I think, again, we've made great strides, and we've made great strides in diversity, and we understand the value of diversity in regards to particularly innovation and creativity. So it's really imperative when you talk about that metric to make sure you're tracking that piece. And then lastly, people are not coming back because they're nervous. And this is particularly true if we look again at SARS, if we look at South Korea data, people did not return for things like elective surgery. And so then when we think about populations from a population health basis, we really do need to think about vulnerable populations, mostly because they're not going to be seeking care, and second, because they're even more vulnerable to the virus itself. So one of the positive news is that when we look, employers should be looking at data, and they have a lot available to them, including things like fill rates in their pharmacy. And so we see that fill rates are very high for, mental health. We see also that fill rates for maintenance medications, which, I hope we continue to extend capacity so people don't have to go out every 30 days to get that. And we see that the fill rates are actually quite good. They're a little bit higher than normal. So those are the kinds of, tracking that I think, again, strategically contemplating, are my employees safe? Are they coming back? And am I keeping them safe? Those are really the key questions.
Absolutely. Yeah. And I think we could have a whole different discussion about the massive unemployment rate we're seeing and what ramifications that has on the health system. But I wish we had 3 more hours to do that. I think right now we've got a poll going out that should be hitting everyone soon. Oh, there it is. So feel free to fill it out. I'm curious what you guys see or thinking after this discussion. And then I think for now, I'll just jump into Q&A. We've got a lot of really interesting questions from the audience, a lot around logistics. I think this is really one of those things that it's going to be really hard. It's going to be really challenging. I think one of the questions we touched on a little bit is, figuring out what to do when you've got folks in different geographies. And so Lorna, maybe that would be great to chat with you about that. How do you navigate, can one place open and then another doesn't for a little bit based on guidelines? Like how does an employer start to sift through that or communicate that to their employees?
So 2 things that you said that I really, communicate was like my favorite word there. So I think one of the things we see employers doing, because there's so much variability and because they, the employee brand, the employee experience is really part of the culture, really creating either a microsite or some piece in which you are communicating and employees know where to go. So they don't have to do 16,000 clicks to figure out how to get things done. But additionally, again, I think we're reiterating that you do need a process in which you can understand what is happening in the local region and what you have to set those standards. Certainly, whether you call it the floor or the ceiling, but whatever is being regulated within the local jurisdiction is necessary. But encouraging employers, and I work with global employers, to really set what are the standards that they think define safety, and what are the standards that they think need to be in place. And those are pretty defined. You have to have decreasing decreasing cases, you need to have capacity in the health system, and you need to have availability for testing should someone be, and contact tracing, should someone become positive. And those, once we get, to the flat and lower numbers, those are excellent public health initiatives, and they work. So employers should embrace them. They're not, they're not something that should happen outside. They should really, again, embrace them. And to Andrew's point, you don't need to know that data. We really are encouraging employers to work with third parties. Say, I don't want to house that data, but I want you as an employee to understand the risks and be supported through them.
Yeah, absolutely. Yeah, another one of the questions is about smaller employers. How do you maintain that level of privacy? But you guys might have just answered that with making sure there's someone kind of you can work with to do that. And I'm sure we'll be seeing a lot of folks try to fill that role over the next couple months. Bryony, I thought this might be a great question to field to you. This is from Rodrigo. I think a lot of folks are thinking about the impact this pandemic has had on our behavioral health, our mental health, in what kind of, being isolated for long periods is doing to us, especially if we have children that we have to manage and, a whole bunch of other stressors on our plates. Bryony, what have you seen coming in, and how is an health plan like Blue Cross address that?
Yeah, so I think you're absolutely right. And we're seeing it on a number of different levels. We are seeing people with already diagnosed mental health conditions feel that those have been exacerbated and worsened by this crisis. We're seeing new cases of particularly anxiety across the population. And it's not it's not to be unexpected. And then we're actually seeing rising cases of alcohol use as well, which is also to be understood with everybody at home. I think there are a number of things. Firstly, I think that the long-term effects of this crisis should not be underestimated. And I think this is an employer discussion. I think it is a health system discussion. And I frankly think it is a national and international discussion. Public health policy, education policy, economic policy should really be thought about in a 30-year time frame, with this as a key event marking what needs to be done. We're about to have an entire generation of children who didn't spend some of their formative years at school. And that's, that is a massive deal. So Rodrigo, I think the answer is we're seeing a lot of it. I think there are big macro answers to this. And then I think there are, individual innovative micro answers to this as well. So behavioral telehealth, I think, is and making it widely available and really low cost and frankly destigmatized. I think if we look at some of the opportunities around this, typically you will see the same level of prevalence of low-grade mental health treatment within commercial populations, business populations, which would be the audience for this, as you do in the Medicaid population. The Medicaid population is much more willing to talk about it. I think, whether one of the positives coming out of this is I think we can all talk about mental health and what it means to feel anxious or isolated much more openly across employers than you may have felt comfortable before. And we should take advantage of that and start instituting that as part of our cultural conversations at work.
Yeah, absolutely. Yeah, it's really interesting I feel like I'm interacting with my colleagues in a different way than I was, checking in on them and having those discussions in a way that I maybe might not have before. And it's been really great, at least personally, to be able to have that channel opened and be able to have those kind of frank moments like, this isn't going great for me, things like that. I think, like I said, there's a lot of logistical questions here. I think a lot of people are really curious what they can fundamentally do, whether it's temperature checks, whether it's antibody testing, things like that. This is a great question from an anonymous attendee, but what are if you had to bucket it out, what are 3 things any employer should do to prepare their physical space to bring people back to the office? Are we at that point where we can start to do that? Andrew, maybe it'd be great to hear from you how you're thinking about it.
Sure. So physical things, I think the first would very simply be, at the minimum kind of masks for individuals. And those masks, I mean, even if you don't have like the highest grade N95 masks, which are of course really difficult to find, there's good data showing that, if every single person were wearing a cloth mask, that would be really beneficial to the entire environment, because now you're having kind of that minimizing of the droplets on both sides. I think there's a big discussion around whether gloves would be effective or not. I've seen some data is showing that that would be effective. The downside is that a lot of people aren't kind of used to wearing gloves during work, and that there might be some issues with contamination because you might touch your face very often, for instance. So I think there's question marks on the glove side. I think social distancing at work is definitely a must. So having people say I'm not symptomatic, and then bringing everyone who's not symptomatic back into the office, with open concept, office plans that are in vogue now. I would probably say isn't the best kind of strategy for kind of minimizing spread. And maybe the third thing is understanding where people work within the environment, and if they then test positive, understanding what areas you have to clean is a component of contact tracing beyond, Andrew and Dr. Friedman were sitting next to each other in the cafeteria. I mean, that part of contact tracing is important, but I think more like what surfaces do you have to clean are also kind of really important. And a part of that kind of cleaning component, going back to the essential employees, one way we've been thinking about the different roles and which roles you bring back first, in addition to who has to return, who could work from home safely versus not, is also this idea that there are staff members like the cleaning staff, like security, that basically create a safe work environment to begin with. If you don't have folks to wipe down surfaces, like that's a really big issue during a time like this. It's a consideration that one should take into account when you're thinking about who you bring back and what number per different role, per different office. So those are some examples.
Oh man, I'm not sure how I'd feel about having to go back to an office and wear gloves while I'm typing, given how nice it is to be at my own home and not wearing gloves or a mask and doing the same job. So maybe I'm on the tail end of things coming back. Yeah, in another kind of specific question, but definitely something I'm curious about as well. Maybe Lorna, you can talk to this. A lot of employers have health centers at their disposal, in their office buildings, things like that. How have you seen those start to interact with this question of coming back to work? Is this something that people are able to leverage as a way of, figuring out those processes, making sure everyone is doing contact tracing? If someone does come in sick, you have a plan. How have you seen that start to play out?
So interesting question. And I think even, kind of touching on both the two prior answers, already on-site clinics were starting to support mental health. So we will see again an acceleration, and it is a place where telemedicine offers great promise, albeit limited, and it's an area where, particularly because again, staffing capabilities, there are again many counties in this country that don't have either psychiatrists and certainly don't have child psychiatrists, so that we really see the use more of AI and other types of clinical extenders, if you will. But from an on-site clinic, it really becomes kind of interesting. We are seeing many of them already working virtually, many of them supporting and working with organizations like Buoy to be able to, kind of respond and potentially be a site where you could do testing. But that said, I think, it brings up a good point, and to continue to reiterate that we are in, this kind of, respond, return, and those things are combined because you're going to have to be in a long haul. But we also think it's really worthwhile for employers to start thinking about reinvention, right? We may, it's kind of like, how do you get them back on the farm once they've seen Paris, right? Even before COVID, we know that 90% of, lots of women and millennials said, I actually want a flexible workplace. So, and the productivity, as we've kind of highlighted, has actually been pretty good. But that said, one of the concerns again is that a response to the economic environment? It's not so great for everyone, and we're going to have to continue to watch marginalized populations and support them.
Yeah, absolutely. We're running out of time, and I'll be sure to pass it back to the health team in a second. But it's been really interesting to have this conversation and hear kind of where we're at. I think a lot of questions around when and how. Correct me if I'm wrong, you guys, but it seems like we're still really in the early days of figuring out how to build the right roadmap. What could we even consider? It's not like, oh, next week we're going to do something. And so I think that's a really important thing to keep in mind. Bryony, you mentioned this issue of certainty, and it's great to have certainty, but at the moment, it really feels like we're in a place where you're figuring out that roadmap, and how to get back to the office is still a really uncertain picture. So I'm going to be curious to see where we're at in a couple weeks or in a month or two, and start to see some of those details come into place, and figure out who's figured out how to do it really well. And yes, we'll have to figure that out. But for now, thank you guys so much for being here and joining me in this discussion. And I'll turn it back over to the health team.
Great. Thank you.
Thanks, Lydia, and thanks everyone, all of our panelists. And now I'd like to introduce Mike Super, who is the winner of NBC's hit TV show Phenomenon and a finalist on America's Got Talent. He's been named America's Favorite Mystifier Entertainer of the Year, Best Performing Artist, and Novelty Entertainer of the Year. We're happy to have him join us, and now here's Mike Super.
That's on, there we go. Hey, everybody. If you've never heard of me, that's okay. I have been brought here. First off, this is an interactive magic piece. So what I like to start with is, so everyone understands, I can still hear you. So to begin, I wanted to thank Dr. Andrew Lay for sponsoring me. So give them a round of applause. They are amazing. Thank you, thank you, thank you. Dr. Lay, can you hear me?
Yep, sure can.
Okay, awesome, awesome, awesome. Okay, so thank you for having me. So I figured we're gonna do some magic today, just to sort of lighten the meeting and have some fun. So first, I'm going to test everybody out. I am holding some cards in my hand here. What I'd like everybody to do right now, in your mind, mentally select one card. In your mind, and remember it. Have you got one? Good. Now here's what I'm going to do. I'm gonna try and make your card disappear. Watch. And hopefully, yes, it's beginning to happen. You can see one card has blanked itself out. And if you take a look, I think you'll find it was your card. Yes? Applaud if I got your card so I can see you, because it's hard to hear. Yes, all right, you guys are wonderful. So we're warmed up. And we're going to do a trick in a moment with Dr. Lay. But first, I want to talk to you about a little known conspiracy theory. I'm holding here in my hands, obviously, a $1 bill. Now I want you to take a close look at that bill, front and back, because here's what they don't want you to know. The Mint actually starts printing bills as $1 bills, but they're actually disguised as $100 bills when you employ the special origami fold. Now you'll watch, the bill never leaves your sight, but if I fold the bill correctly, you'll see it changes and adds 2 zeros to make it a $100 bill. Now, this saves the Mint on printing costs. Now, how do they disguise it again? Remember, all they do is they're covering up the 2 zeros. Watch the $100 bill as I fold it up. And I literally mask the 2 zeros from you. It never leaves your sight. But if you take a look, you'll see if I hide the 2 zeros, it looks exactly like a $1 bill. So if I ever get to meet you live, please bring me your $1 bills and I will teach you that. But we're going to get to the main event. I'm super excited, Dr. Lay. I sent you a package in the mail. Is that true?
Yep, I got it right here.
Excellent, excellent. So do me a favor, if you would, we are now on air, so open that up. I figured, so with everybody here, we're going to try a piece of magic, and you are going to represent the audience, good sir. Excellent. He tears it open, and inside will be another envelope. Tear that open as well. We will throw caution to the wind here.
Wow, whoever taped this did a really good job.
Oh, did they?
All right, here we go, here we go. No, I got it.
Okay.
Okay.
Very nice.
We got
Very
this.
nice. So go ahead, open it up as well, sir. Inside, you are going to find a tin foil packet. Yeah. Yes. Inside of that is a deck of cards. Unwrap it, please. I use tin foil to ensure that the magic will be fresh when it arrives to you. Excellent. Look at that. Very nice. Now, there's rubber bands on that deck of cards. So what I'd like you to do is remove the rubber bands and hold the deck face down in your hand. Good. Now, do you have a surface, Dr. Lay, in front of you that's out of your camera's view? In other words, so I can't cheat and look at what you're doing.
Yep.
Yes. If you would, set the cards face down on the table in front of you.
Okay.
Good. Now, playing cards are a lot like tarot cards. People don't realize this. They're distantly related. It's all based on the calendar. For instance, a deck of cards has 52 cards. There's 52 weeks in a year. It has 4 suits. There are 4 seasons. If you add up all the numbers on the deck of playing cards, they add up to 365, which makes 365 days for the year. And the Joker is for the leap year. It's actually kind of interesting. So we're going to play into that right now. So just like tarot cards, what I'd like you to do is you're going to cut the cards with just one hand, lift off half the deck, set it to the side, then replace the other cards on top of it. This is what they do in casinos. It's called killing the deck. That way there can be no cheating. Have you done that?
Yes.
Yes. Okay, so do me a favor. Now with your opposite hand, I would like you to do the same thing. Lift off half the cards. You can cut it thicker, set it down, and then replace the cards. So you have a pile of face down cards in front of you, sir, yes?
Yep.
Okay, now it is your choice. You are running this with me. Would you like to cut the cards again, or are you happy there's no way I could know where you cut the cards?
I'm happy, Mike.
Okay, very good, sir. So I first want to show you how difficult this is. So if you would, I want you to just take one finger, touch the top of the top card of the deck, yeah, and a card will jump into your head. I want to show you how difficult this is. Name any card. Go do it now.
King of Spades.
King of Spades. Do me a favor. Lift up the top card and tell the audience what card it is. Just the top card. Lift it off. Show it,
2 of Spades.
show it to the audience so they can see.
Okay.
It is indeed the 2 of Spades. Not what we were after, but this is important because you can just throw that away for now, sir. Just toss it away. Now, pick up the rest of the deck in your hands.
Okay.
Even you don't know what the cards are. What I want you to do is the top card, deal 1 card face down to your left. Yes. The next card face down in front of you to the center. And then the last card face down to the right.
Okay.
Okay. Now, take the next card and just slide it into your pocket. So there's no way you can even see that card.
Okay.
Okay. Now, here's what I want you to do. Set the rest of the cards aside. I'm going to try and read your facial expressions over Zoom, sir. Are you ready?
Yeah.
Yeah, here we go. Are you ready? The card to your left, which represents your past, what I'd like you to do is so don't show it to the camera or the people watching. Just turn it face up so only you can see it. The card on your left. Good.
Okay.
You've seen it. You've registered it. Okay. Look at me. Oh, yes, I'm getting It's either a red card or a black card. And the way, oh, now, which I know seems, but when I said red, I noticed that there was a facial tick. Is it a red card, sir?
Yes.
Yes. Okay. So if it's a red card, that makes it either a heart or a diamond. Don't say it. I'm going to say heart. You say no. Are you ready? Say heart.
No.
No. Diamond.
No.
Okay.
Sorry.
It took you
Are you
longer.
asking
I'm
me to say
going
no
with
to both,
heart.
or-
I'm going with heart. Is it a heart?
Yes.
Yes. Okay. Here we go. It's either high or low. Think of it. I'm getting oh, that was clearly a high card. You're looking confident as if you would win in a poker hand. I'm getting almost like a picture card. I'm getting the Queen of Hearts. I'll lock in on Queen of Hearts.
That's right.
Show it to the camera so everybody can see. All right. Toss it away. Toss it away. All right. But that could have been a 1 in 52 chance, sir. I want you to just flip over the next one and look at it. Don't say a word. Just look at it. Got it? Oh, that was easy. That's the opposite. That was opposite in almost every way. I'm getting a low card, a black card. I'm getting a red card, but a low card. I'm getting a 3 of diamonds is what I'm getting. If you would, is it the 3 of diamonds, sir, that you cut to?
Yeah,
It
absolutely
is.
right.
That's
Amazing.
2 for 2,
Yeah, wow.
Dr. Lay.
Wow.
All right, I'm getting excited. Now, the last one I'm going to have you tell me in tarot fashion. So what I want you to do is take 2 fingers like this, and don't look at this card, but just put your hand on top of it. Yep. And if you could wish one thing for the future personally, we would all wish for this pandemic to go away. We would all wish for world peace. But something small and personal for you and your family, just touching it. If you could wish for one small little thing, what would it be?
For the family to be reunited.
Reunited. Okay.
Yeah.
Okay. That is amazing. That is interesting. That card is actually the unity card in the tarot deck, which is represented by the Queen of Clubs. It's interesting. You would be inspired by the unity card, the Queen of Clubs, by just touching that card. Lift it up, turn it over, and show it to everyone.
Wow.
It is indeed
amazing.
the Queen of Clubs. Now, we didn't set any of this up either. That's important to remember, sir, right? In fact, you have 1 card in your pocket right now. Yeah? You cut the cards, you shuffled them yourself. There's no way I was in control of any of that. You saw all the cards are different. But what I want you to do is reach into your pocket and take the 8 of Hearts out of your pocket. It is indeed. Give Andrew a huge round of applause. Dr. Lay, you are an amazing magician. Amazing
Mike,
magician.
that was amazing.
Now, we don't have a ton of time, sir, so I figured I'd try one last little piece here. Yeah. Now, is there a way we can involve anybody else on the video side? Like just I'll let you choose or the team choose one person at random right now. If that's not possible, I have a different way we can do it.
Well, are Jody or Bryony, are you guys back on, or Emily?
Yeah, if we could pop them on, that would be amazing. Okay, Jody was first. Jody, you win. Jody, before I began this, before I even started, what I did was I turned 1 card in this deck of cards, which will not leave your sight, upside down. Okay. Yes? What I'd like for you to do right now is to just think of any 1 card in your mind. Okay. 152, but not the Ace of Spades, because that's one everybody immediately thinks of, right? So if you have to change your mind, change it again, right? And we did not set this up. We never even met, Jody. But for the first time, tell them, what card did you merely think of?
The Queen of Hearts.
Queen of Hearts. Check this out. I'm going to do this as fairly as I can here. Okay, I want you to see. All right. As I go through the deck, I'm going to show you in the deck here, right underneath the most common card, the Ace of Spades, is 1 card. And that is the only card that is upside down. You could have named any card, but you named, check it out.
Wow.
That's crazy.
the Queen
Like,
of Hearts. Now, before I disappear, I figured we can do this one of two ways. I could teach everybody a trick, or if people at home have a deck of cards and they could remove the ace, 2, 3, 4, 5, 6, and 7 of hearts from it quickly, I could turn everybody into a psychic. So I'll leave it up to you, Dr. Lay. Would you like me to teach a trick or turn everybody into a psychic?
actually, could you teach a trick?
Yes, you got it.
I was part of the
Definitely.
magic club in college, so this is like really cool.
Oh, nice. Okay, you got it. So,
Yeah.
I am going to teach you. This is one of my favorite tricks to do. All you need is a deck of cards, and the great part about it is you don't even need all of the cards to be in it. Okay. So now normally you would have someone select a card. All right. So I'm just going to pull one card out at random. Now. I'll do the trick first, and then I will teach it to you, okay? If you don't already know it, good sir. So watch. They will take their card, which you normally wouldn't see, the 5 of clubs. And you take a deck. Now watch. You have them insert their 5 of clubs back into the deck. Now, you square them up. You place the cards behind your back, and you tell them you're going to turn one card without looking upside down, which I have done. If you take a look, if I spread through the cards, now I normally wouldn't have known what the card was, but you'll see one card ends up upside down in the middle of the deck. This is a very simple trick that any beginner can do, and here's how we do it. Check it out. There's a secret setup. Someone selects a card. We'll use the 5 of clubs again. Now, you turn your back so you don't see it. When you turn your back, all you're doing is flipping the deck over upside down and turning the top card face down. That's it. So it looks like this, but we all know it's really just one card upside down. So when you come back around and they insert their selected card, what they're doing is they are actually inserting their card for you upside down. So you push it in and you put the cards behind your back. And behind my back, all I'm doing is I'm taking the card and making it the right way again. When you bring the cards out, you bring them back out face down, and you can even have them spread through, and their card will actually be upside down. And that is one of the most easy tricks that anybody here listening can do in quarantine and become a superstar. So I greatly appreciate you all having me on. Thank you for all that you do, Dr. Lay and team. And hopefully I will get to see you again.
All right. Thanks a lot, Mike. Really
Thank
appreciate
you.
it.
Thanks, everyone. Hope you enjoy the rest of your day.